right, well, let's get started. Thanks to everyone for joining us. My name is Anna Plankey. I'm a junior analyst at the National Center for Healthy Housing. Thanks for being here and for your interest in this topic. With the support of NCHH, the National Environmental Health Association, and as part of the Early Care and Education Collaborative, the National Center for Healthy Housing presents this webinar, Healthy Homes Guide to Cleaning and Disinfection, Key Messages. Before we fully jump in, I'm just going to go over some quick logistics. This session will be recorded and available to view and share shortly after we conclude today. That will come out via a link to all of you who have registered. Attendees are in listen-only mode, but that doesn't mean we don't want to hear from you. I ask and invite you to please enter any questions or comments you have throughout the presentation into that GoToWebinar chat or question box, and those are likely located on the right-hand side of your screen. We have set aside some time today at the end of the webinar to answer all of those questions, and we'll get to as many of them as possible during our time together at the end of this session. Next, let me introduce you to our speakers today. On the panel, we have Robert Powitz, Therese Pilonetti, and Hester Paul. Bob is currently Principal and Technical Director of R.W. Powitz & Associates, a professional corporation specializing in forensic, environmental, and public health services to industry, law firms, insurance companies, and governmental agencies. Dr. Powitz is licensed as a Sanitarian in Connecticut, as well as being registered as a Sanitarian by the National Environmental Health Association, where he is also credentialed as a certified professional in food safety. Therese is a unit manager in the Division of Environmental Health and Sustainability within the Colorado Department of Public Health and Public and Health Environment, and has close to 25 years of experience in public and environmental health. She oversees the statewide childcare and school inspection programs and is currently leading a team of school and childcare subject matter experts during the state's COVID-19 response. Next, we have Hester Paul. Hester has led Children's Environmental Health Network's Eco Healthy Childcare Program as its national director since 2010. The EHCC program aims to support early care and learning professionals throughout the nation in identifying and reducing harmful environmental toxics within and around childcare facilities. Ms. Paul and her colleagues work closely with the National Resource Center for Health and Safety in Childcare and Early Education, Childcare Aware of America, the National Association for Regulatory Administration, the Environmental Law Institute, and the National Association for Education of Young Children, and others to update national health and safety standards for early care and education, and to offer comprehensive training, technical assistance, and resources to childcare professionals. So with that, I'm going to turn it over to Therese to get us started. And Therese, go ahead and take it away.
Great, thank you so much, Anna. I'm going to start off by covering some basics about cleaning and disinfecting. So to start, cleaning is really the removal of soils and gross particles from surfaces. Cleaning typically removes microorganisms, but doesn't necessarily kill them. Cleaning is appropriate to remove soils and dirt from most surfaces and is a necessary step for effective sanitizing and disinfecting. There are other things that are considered cleaning too, and that includes things like laundering and vacuuming, but basically cleaning reduces the microbial load and organic matter so that sanitizing and disinfecting solutions can really do their jobs. Disinfection, on the other hand, is the elimination of most or all pathogens. It's generally accomplished in home and childcare type settings with the use of liquid chemical solutions. Commonly in childcare settings, we see sodium hypochlorite or household bleach and water used for disinfection. But there are other mechanisms for disinfection, including heat and a few others, but we're going to focus on the chemical solutions today. Disinfection on most surfaces is necessary when you have surfaces that are likely or have been contaminated with pathogenic microorganisms or high hazard body fluids. And those include surfaces like changing tables, toilets, and other surfaces that may come in contact with feces, blood, or vomit, or in response to cleaning up after someone who's sick or during an outbreak, for example. I'll make this point a couple of times, but surfaces that are mouthed by children or used for food should really be sanitized rather than disinfected, but sometimes they do become contaminated with high hazard body fluids, and we'll talk about that later. So some important things to think about with disinfection. For quite some time now, the CDC has had recommendations about disinfecting routinely commonly touched surfaces. And this would be in addition to those surfaces we know to be in contact with high hazard body fluids, such as the toilets and changing tables and things like that that we just talked about. But this has just recently, actually as late as this week, been updated. We'll get into that quite a bit more about those changes and what it means specifically for childcare settings. Oh, I actually linked in here, and I think they may be putting those links in the chat for everyone to have easy access to. These are the updated links from CDC and EPA regarding recommendations for routine disinfecting after cleaning in homes and facilities. And facilities is kind of a general term. It's not specific to childcare schools. It's just specific to a facility where it's indoor space where people live or work or gather, but not necessarily a home. And then there's specific information for homes. And linked within these pages are some really great new documents from EPA about the safety of using cleaning and disinfecting products as safely as possible. They're wonderful links, and so I really recommend that. Also linked here is EPA's List N. These are disinfectants that are known and have been tested to be effective against SARS-CoV-2, the virus that causes COVID-19. So just a little bit about sanitizing. Sanitizing is not as strong as disinfection. It typically removes pathogens and is safe for surfaces that are used for food preparation and service, but also for toys that may be mouthed without rinsing. So it's really helpful. It's definitely effective. It's just not as strong as what we would use in a disinfectant type of solution. Typically, sanitizers should be EPA registered and approved for use on food contact surfaces. And again, that's without a rinse step. That's very important when understanding the differences and choosing the right product for the right surface. They can be purchased pre-made. Sometimes you can make your own solution from a concentrate such as household bleach, as long as it's not scented and doesn't have additives that would impact its ability to sanitize a surface and not leave a residual for items that might have food or be mouthed by children. Always follow labeling instructions for mixing and contact time. And contact time does refer to how long the surface remains wet. So all disinfecting and sanitizing products should really be EPA registered. The EPA registration number is usually pretty easy to find on a product's label. Once they go through the process of registering, it's really a selling point. So it would be a surprise to not find the EPA registration label if a product had indeed obtained one. The wording on labels can be so small and difficult to read, so I could understand that it might be hard to find. But once you have that number, what's really helpful is to put that number into the National Pesticide Information Retrieval System. This is a really great nationwide system. Lots of states link directly into it and have tons of information about products that we use for sanitizing and disinfecting, including the proper use, surfaces they should be used on, the appropriate contact time, whether you're sanitizing or disinfecting, any warnings or precautions for use, like keeping away from children, and then if they need to be used with proper ventilation or even personal protective equipment. I really recommend checking this site out and making sure that you're familiar with it and can really relay this to regulated facilities. I'm going to say this probably a lot, but disinfectants and sanitizers always must be used in accordance with labeled instructions. And any time we're around storing, using these types of chemicals, we want to have ready access to poison control. And I've linked the national number here, but to have it posted and readily available wherever you store or use chemicals is a really good idea. Several disinfecting products do require proper ventilation as they're being used. And I wanted to point out something that we're seeing a lot in childcare facilities and schools here in Colorado, and that is that there's lots of devices that are being heavily marketed to schools and childcare facilities. And some of them are like aerosolizers or foggers or sprayers of disinfectants, and they're marketed as these great tools to clean the air, clean surfaces by the use of, aerosolizing the chemical disinfectant. And really, these are not necessary. and many pose potential dangers, especially in areas where children live and play. So we do not recommend them. Typical, wiping off and using according to labeled instructions of products that you've probably used all along, especially if you're in a childcare facility. That's really what you should continue to do. There are products, like I mentioned, though, that do require ventilation. And when you see that on a label or in that national registry, you do want to make sure you're opening windows and doors, turning on exhaust fans if you have one in the area, to increase as much fresh outside air as possible. Sometimes there's areas we need to clean and disinfect that are small spaces. They don't have windows or doors, or maybe they don't have good ventilation. In those specific areas, you don't want to linger. Might be good to wear some eye protection and a mask, and then make sure that you're cordoning off that area to prevent others from entering. You should probably be using these types of chemicals when children are not present. So in a childcare facility, specifically at the end of the day after the children leave, that would be probably the best time to use disinfectants. There are disinfectants and labeled products that do require the use of personal protective equipment. And again, you want to make sure you're checking that label and using it when you're using a product. Another important note to make here is anytime you're cleaning up high hazard body fluids or cleaning up after someone that's sick, you should be wearing gloves and potentially eye protection and gowns as well, just to keep yourself protected from any pathogens that might be present. So when you're using chemicals, you may have to use gloves, you may have to wear eye protection or a mask. What I've done here is link to a document that CDC has that has great information about not only how to use each one of these pieces of equipment, but also how you can appropriately and safely don and doff different pieces of equipment in sequence. So it's really important to understand, what should be put on first, what should be taken off first, and how is that done in a safe manner. The link that I believe was put in the chat is an actual poster you can find. You can post that if you find that helpful, with all of that information in a very easy and understandable way. Of course, anytime we're dealing with chemicals, detergents, sanitizers, or disinfectants, we want to make sure that we're storing them safely and according to labeled instructions. So some things that you might want to look for as far as the labeled instructions, we've talked about ventilation. Concentration is very important to know what concentration, if a chemical comes in more of a bulk concentrate and you have to dilute it with water, you want to make sure that you're doing that right. Following the contact time is the time that it remains wet. I think I've mentioned that. Personal protective equipment, and then of course storage. Never mix chemicals, always wash your hands after using them, and have ready access to poison control. I wanted to point out this article. This is an MMWR from CDC that did a quick study about the number of individuals, adults that use chemicals or disinfectants, and how many people tend to do it unsafely in response to COVID-19. So we're seeing a lot more cleaning, a lot more disinfecting. I think that's okay, but it has to be done safely, and we really need to make sure people understand the precautions and the things we should and shouldn't do when we're using those products. So using cleaning and sanitizing and disinfecting agents really is just one part of the whole layers of defense that work best together for mitigating COVID-19 transmission in homes and childcare facilities. So I just wanted to bring to your attention, all of these things are still important. Making sure that you're keeping distanced from people who are outside of your household or even your cohort if you're in a childcare setting, avoiding crowds, limiting exposure with yourself and others, wearing a mask, washing your hands. In fact, the new CDC guidelines for cleaning and disinfecting regularly calls out the fact that hand washing is probably as effective, if not more effective, than the routine cleaning and disinfecting for keeping fomite transmission low. So that's really good news. That's a great strategy for preventing transmission of any kind of illness, not just COVID-19. And then of course, respiratory etiquette. making sure you've got good ventilated spaces, you're increasing those air exchanges with outside air, and then absolutely being responsible when using, storing, mixing any kind of sanitizer or disinfectant. I think I might be turning it over to Dr. Borowitz at this time.
Yes, thanks, Therese.
Sure.
Bob, go ahead and take us away.
Okay, this is on the what, why, and how of a clean home. Let me give you a little bit of background here that kind of puts things in proper perspective. Everybody in a home or in a child care center or anything where you have a group of people, if they're living together, within 48 hours, every occupant will carry similar bacteria. That's respiratory, gut bacteria, skin bacteria. And we shed about 20,000 to 100,000 particles per hour. And this includes skin cells, dander, hair, mucus from speaking and wiping fingers on surfaces. So we normally in a home, we're not that affected by each other unless it's introduced in the home. And mostly, if you think about it, it'll be introduced via a respiratory route. So maintaining aesthetic cleanliness also will remove most biological soiling. In the industry, we realized that if we clean well, we also remove about anywhere from 94 to 96% of any organisms that are on a surface or in an air, anything that we're dealing with. So what we try to do is not emphasize disinfection or sanitization. There's a time element for each, and one is a sanitization is a public health term, but we try to clean as possible. We try to maintain things like clean rooms by cleaning mostly. Let me just mention this. The disinfectants that are listed by EPA are toxic under the Federal Insecticide, Fungicide, and Rodenticide Act. There are a lot that are exempt under 40 CFR, which is the law that also has the FIFRA regulations in it. So understand that bacteria, fungi, viruses are part of normal soiling, and removing the soil, including vacuuming, will reduce the total bioburden in a home. And it actually does. Cleaning, what we're trying to do with cleaning is design the cleaning so you can avoid using as many chemicals as humanly possible. So the soiling that we see in a home is either wet or dry, and it consists of the physical. As we know, going into a house, you get the sand, dust, biological dirt, grass, detritus, and so on. We have chemicals coming in, such as pesticides, salt from salting in the winter, fertilizers, household and other chemicals, and cosmetics, believe it. And then biological would be mostly skin cells, dander, and pets just contribute the most of anything. I want you to be aware also of allergens, and that includes house dust, mold spores, pollen, and fabrics. Fabrics all shed, you see that in your dryer. And of the things that cause the most problems, things like dust mites, cockroaches, bed bugs, rodent urine, and cat and dog dander. So these we have to be aware of and clean for them. And the sources of allergens, of course, we have pets as ranking number one, carpeting, soft furniture, stuffed toys, bedding, mattresses, and so on. So prioritize the surface cleaning of allergens resulting from pets and smoking, if there's any smoking in a house, and then target the cleaning as to the type of soil. If the soil is dry, physical dry, then vacuuming, but make sure that the filter on the vacuum doesn't redistribute the soil all over. So target the cleaning to the soil type and the soil characteristic. The label on many products will let you know exactly what that target is. Unfortunately, household products are pretty lax in labeling their products, whereas the commercial products are fairly decent. If a household member has a communicable disease, and here we're talking about something like the SARS-CoV-2, focus on cleaning on the route of transmission. If it's respiratory, remember they're spraying out droplets, and droplets evaporate to droplet nuclei, which are very small and remain suspended. So cleaning horizontal surfaces, tabletops, armrests, and so on, this will help with the respiratory spread or preventing respiratory spread. And then fresh air if possible. I know in the winter it's not easy, but even in facilities, what we try to do, there's 10% crackage in a house. So if you open up a window a little bit, it lets a little fresh air in. It doesn't affect the heating that much or the cooling in the summertime, because there's a lot of radiant cooling and radiant heating in the room itself. The oral fecal, this would be if someone has vomiting or pretty bad diarrhea from either foodborne or waterborne illness. There we target the bathroom because that's where it happens. Include the shower curtain if there is one, and frequently touch surfaces such as the flush handles and sink faucets. Dermal, this would be just sitting around, and I already said that we shed anywhere from 20,000 to 100,000 particles per hour. This would be chairs, bed, or any surface contacting skin, such as exercise equipment. And exercise equipment should be a smooth, washable surface that can be cleaned. And again, follow manufacturers or online instructions on cleaning to avoid damage or discoloration. And this even holds true with furniture. You can always go online from where you buy your furniture, mention the fabric that you have on it, and they will give you the proper way on how to clean it and what to use for that cleaning. My way of doing it is using a mild detergent to clean frequently touched surfaces such as flush handles, faucets, doorknobs, and so on. Those things have to be cleaned regularly. And the rationale behind this is hands touch all surfaces as well as the body. The oils on the skin will carry the germs and protect those germs on the surfaces. So we got to get rid of the oils. That's the mild detergent. If a sanitizing agent or a disinfectant is required, select the least toxic agent possible. And of these, alcohol, 74%, which is ethanol, isopropanol, ethanol will work too. Isopropanol is the 74% that's rubbing alcohol. Hydrogen peroxide is a very good sanitizing agent. L-lactic acid, citric acid, peroxyacetic acid, sodium bisulfate. And a new one has come on, and that is hypochlorous acid. And these are exempt from EPA, but they do a job and they're non-toxic. So wipe on is preferred if you're using anything of low toxicity, even a disinfectant that is registered. Spray on if necessary, but do not use an aerosol. So in other words, these aerosol disinfectants that come out of a can, there's nothing worse to hurt a child's respiratory system or anyone who is compromised. We know this. There's plenty of research on that. Get rid of any aerosol you have, and that's even the odorants that are in there. You don't need them. Laundry is just like garbage. It's contaminated, but we reuse it. So if we handle soiled laundry as if it were garbage, including soiled diapers and used kitty litter, don't shake soiled laundry loaded directly into the washer. If contaminated, select a cycle with a pre-rinse it first, then wash at the hottest setting and dry on high heat. Drying on high heat desiccates or will dry out any organisms that are in there. And we use the drying cycle as a disinfecting cycle in hospitals and in nursing homes. Clean hampers after each use or employ a liner. Wash the fabric liner with the load. So that's kind of laundry. Clean the washer periodically. Household washers are not the greatest. Front loaders are better than top loaders. And my advice is set the washer to the highest level and the hottest setting if you're looking to remove the bioburden from the laundry. And then periodically add 4 cups of white vinegar, cleaning vinegar, that's 30% stuff, to the wash cycle. And after the cycle starts, pause the machine and allow it to sit for an hour and then finish the cycle. That decontaminates the entire inside of the washing machine. Ventilation. Maintain fresh air as much as possible. Like I said, most houses have a 10% crackage. We've made houses very, very tight recently, and that's not the best thing. So open a window every once in a while to allow for air exchange, even in the winter. Consider annual duct cleaning, including the dryer duct, the bathroom vent, because bathroom vents go out to the outside, and kitchen vents are normally vented directly into the attic. So if they're dry, if they're cleaned regularly, we prevent a lot of blockage in them, and we use them now to move air. Keep all air conditioning equipment clean in accordance with manufacturer's instructions. Now, equipment includes air conditioners, hot air furnaces, humidifiers, dehumidifiers, and air cleaning devices. I got a buyer beware. There are no regulations or valid certifications of air cleaning devices such as filters, ultraviolet light, air ionizers, or what we call air purifiers. Buyer beware. Do your homework. These things may or may not work. I have a collection of things that were sent to me of horror stories of things where the manufacturer makes claims that are not substantiated, and these things absolutely don't work. Remember, I'm in forensics. Okay, here are the principles of a healthy home. Keep the home dry. If there's a roof leak, fix it. If there's a wet basement, dry it. Keep it clean. And aesthetic cleanliness is good enough for most applications. Keep it safe. Keep it well ventilated and pest-free, contaminant-free, well-maintained, including lighting. You cannot see dirt if it's poorly lighted. And if your home is energy efficient, you're also finding that you're gaining on the healthy home aspect of it because you're using less of a carbon source or something to heat or cool that house. That's the last one on mine.
Thanks, Bob. Next, I'll hand it back to Therese to talk about special considerations for childcare settings.
Great, thank you. So we've discussed detergents, sanitizers, disinfectants. They all can play an important role in the prevention of disease transmission within childcare settings. However, any of these chemicals that we use to clean, sanitize, or disinfect can pose hazards to children and staff. So again, it's so important to follow those labeled instructions and the EPA registration instructions and precautions, including making sure you're keeping away from children, your safe storage, safe and proper storage, including exposures to light, heat, and keeping them inaccessible to kids, using proper ventilation and personal protective equipment, as well as making a note of expiration dates. Some products do have expirations, and they will potentially be less effective or even unstable if they're past that expiration date. So it is important to note that and follow those instructions. And as the previous speaker mentioned, chemicals and disinfectants can certainly trigger things like asthma attacks, eye and skin irritations, and if swallowed or inhaled can be very dangerous. So always have ready access in your childcare facility for poison control centers in your area. I did want to note this, I think I've kind of mentioned this, but sometimes we do have toys and food contact surfaces that are either contaminated, someone gets sick, maybe they wind up in the toilet. At that point, you could disinfect them, but you always want to make sure that they are rinsed thoroughly before they're returned to use. And always consult your local public health and licensing agency for specific rules in your area. So I mentioned earlier that the CDC updated its guidance for cleaning and disinfecting. So all along, they've recommended daily cleaning and disinfection of high-touch surfaces. They've actually updated that just this week. I provided the links earlier that cleaning daily, as long as you don't have case within your facility within the past 24 hours or an ongoing outbreak of COVID, that you could clean daily rather than clean and disinfect. And I think that is really good news for all the precautions that we're sharing with you today. There are other considerations. You may want to increase your cleaning or clean and disinfect. If you do have a facility that's in a high transmission area, if you suspect people are not adhering to mask wearing consistently, not hand washing consistently, or maybe you serve a population that's at higher risk for severe infection from COVID-19. In those cases, that is a choice that can be made by the center, whether to increase their cleaning to more than daily for high touch surfaces or clean and disinfect those surfaces. So I think that that is good news, and you can certainly, like I mentioned, there's tons of great information about the safe use of chemical sanitizers and disinfectants linked directly in the new updated guidance. I just wanted to make a couple more points about chemical sanitizers and disinfectants based on some of the things that we've seen over the course of the past few months with the COVID pandemic ongoing. So sanitizers and disinfectants should never be used on skin. Unfortunately, I have come across some guidance that has kids either wiping their feet or wiping their hands with sanitizing wipes or disinfecting wipes, and that is not a good idea. Always remember that the overuse of chemical sanitizers and disinfectants can pose hazards to the occupants, especially children. So we want to do that as safely as we possibly can, following all of those precautions and labeled instructions. Children shouldn't be expected to do the disinfecting themselves. I see this a lot in school settings, mostly where anytime a kid uses a computer station or a device, they're expected to use a disinfecting wipe on those surfaces when they're done. That is really not advisable. As innocuous as those wipes may seem, a lot of them are indeed labeled for to be kept away from children and not to be used by children. Another thing to keep in mind, I think this has sort of been implied already, but when it comes to chemicals, more is definitely not better. And I think considering least toxic and the fewer chemicals you can use is really a good point in any setting, especially around children. And then again, never mix chemicals, always follow those labeled instructions and be sure you have ready access to poison control numbers for your area. I believe that might be the last of my slides. Okay, yes, I'm going to turn it over to Hester Paul to talk about childcare settings within homes.
Great, thank you. Can you guys hear me okay?
Yes, loud and clear.
Okay, wonderful. Hi, everyone. My name is Hester Paul. I'm the National Director of our Eco-Healthy Childcare Program at the Children's Environmental Health Network. So some of what I'll be sharing with you today might be a little bit redundant of what you've heard before, but I think that's okay, just to kind of go over what we all see as very important points. So we, within this Eco-Healthy Childcare Program, are thinking about all types of childcare, but for the case of this webinar, we're going to hone in specifically on home-based childcare or family childcare you might have had it referred to before. So I think the first thing to think about is right now we know that the layered approach to stopping the spread of COVID is the best approach. So be thinking of all of these suggestions together. So we want, hopefully, providers to be vaccinated when that's possible within their respective state. We want to think about personal hygiene, encouraging both staff to stay home when they're feeling sick and also having families keep their children home when feeling sick. Physical distancing, wearing masks, hand washing often, really thinking about ventilating, which has been ventilating as much as possible and opening windows, as was said before. But if you can't do that for some reason, to be really thinking about portable air cleaners, making sure that HVAC systems are, we're changing out the filters regularly. And then also for the topic of this webinar today, really cleaning, sanitizing, and disinfecting surfaces in the appropriate way to make sure that we're protecting these little guys around our country from unnecessary exposures to environmental health hazards. So the first thing that we want to really make sure that everyone's on the same page about is making sure that you're adhering to your state-specific childcare licensing regulations. So we absolutely want you to be paying attention to the guidance that's come out from CDC and EPA. But first and foremost, if you are a licensed childcare facility, you need to make sure that you're also adhering to those regulations that are put forth within your individual state. So quick sidebar, all 50 states have different childcare licensing regulations. And so just making sure that you are abiding by what's put forth within your state. Much of it is very much in tune with what you're reading with the CDC, but some things are slightly different, so you want to pay attention to that. Also, there are national health and safety standards that are released. It's called the National Resource Center, they're Caring for Our Children, are the group of standards. And within those, they are currently updating some of them to be more specific to pandemic response or COVID-19. So these are standards that you can check with specifically around cleaning, sanitizing, and disinfection, and then also ventilating properly. So as been shared already, you want to routinely clean first before you're sanitizing or disinfecting. We want to encourage folks to always choose products that have no fragrance with them. It's just unnecessary chemicals that we want to avoid kids' exposure to. And then again, always making sure to be using the various products according to their specific labeling instructions. So ventilate. This is very important, not just because we're cleaning and disinfecting, which is what we're going to talk about in this slide, but also because we know that for COVID-19, that's one of the things that's most important. So I think in the beginning of this pandemic, people thought that the response was just to kind of clean and disinfect our way out of it. And now that we're realizing that we really need to pay attention to ventilation. And so just really thinking of that combined approach of all different strategies. So as was shared before, we want to avoid the use of aerosols and foggers. So just think about any type of aerosol. Let's use the example of a PAM spray that you use for cooking or that you might choose to use. Those particles are so microscopic that they're just breathing, they're very easily inhaled or breathed in. So you want to avoid all of that. Pretty much any product that you want that you may be used to in an aerosol can be found in a direct spray or a wipe. So from this point forward, you want to avoid all types of aerosols and other examples that you may not readily be thinking of, but any kind of deodorants or hairsprays, cooking sprays, different fragrance sprays in the bathroom would be a double no because it's an aerosol and it also has unnecessary fragrance chemicals that we don't need. We really just want fresh air and we want the smells within our facilities to just be very much neutral. When you're choosing cleaning products, so again, not sanitizing and disinfecting, but cleaning products, so that first step, we encourage you to choose products that are third-party certified by either Green Seal, UL, which is formerly Eco Logo, or EPA Safer Choice label. We have a resource that we developed from the Children's Environmental Health Network, and we provide the link there. And it's kind of a very easy document that was intended for childcare professionals, just front and back. And within there, there's a whole bunch of hyperlinks to other resources and information that we have found to be the most useful and kind of non-intimidating and easily understood. But it kind of walks through different strategies for safer cleaning and disinfection within early care and learning. So one thing to think about is just making sure that you have developed a regular schedule. I think that helps everyone outside of childcare also, just making sure that you are routinely thinking about following best practice guidance for cleaning, sanitizing, and disinfecting. So besides making a schedule, I think the second step is making sure that all staff are on the same page. So it might be smart, on Monday mornings or at a specific time per week to bring all staff within your facility. And for home-based childcare, it might just be 2 or 3 of you together to make sure everyone is on the same page with expectations. And as shared earlier, you want to be very clear on what you can clean versus sanitize and disinfect. So if you're fine to just clean something, you don't want to sanitize or disinfect because then you are bringing unnecessary exposures to these young bodies that are quite vulnerable because of their developmental window. So in the example here that we provide of a plastic toy, first of all, you'd want to make sure it's the right kind of plastic. And for more information or fact sheets on trying to figure out better plastics from others, we have those fact sheets available on the Children's Environmental Health Net website. But you want to make sure that these are things that if they're going to be mouthed by a child, they're going to be sanitized and they're not going to be disinfected. So really just being very thoughtful about when you're cleaning something versus sanitizing and disinfecting. We also have a resource here for you, Appendix K of Caring for Our Children. So again, that's from the National Resource Center. The primary website is nrckids.org. But this appendix will go through very much specifics of when and how to sanitize and disinfect. This was gone over a little bit before, but you want to clean and launder kind of soft and porous materials. So thinking about maybe like a stuffed animal or things, cuddly items that young children have. We talked about this, but it's very important not to disinfect something that was going to be mouthed by a child. So thinking about a pacifier or a chew toy, that's something that you want to make sure you're sanitizing. You want to routinely clean outdoor play areas. So, you have little kids, they're into various things and they're touching their face. They may be touching their saliva, right? This is not shocking. And so you just want to make sure that you have regular cleaning practices. And again, looking back to your schedule to making sure that all staff are on the same page. So what was shared also before is that we know some of these ingredients in cleaning and disinfecting products can be toxic. So we want to be very thoughtful about what you're choosing. And then also remember, so I think it's just 2 main points from my perspective is be thoughtful about what you're choosing, do the research on the front end, make sure that you are choosing something that is for the job that you're trying to do. So when you're cleaning and you know that that's all you need to do to abide by CDC guidelines or your child care licensing, then you're just cleaning and you're using a third-party certified green cleaning product. If you do need to sanitize or disinfect, then you're looking for something that's EPA registered. You're making sure you're choosing a fragrance-free product. And again, the resource that we shared with you earlier in the webinar is to look at the List N tool. Okay, so you want to make sure that you're choosing things with safer active ingredients. So notice that we say the word safer because when you think about a young child and their vulnerable bodies, you know, the least exposure to all of these chemicals is actually best for them. So one of the resources that we think is most helpful is from Informed Green Solutions, and it's called Choosing Safer Disinfectants Active Against COVID. So very specific, the link is right there. And another resource for you is from the Toxic Use Reduction Institute, a safer disinfecting list. So the work has been done for you to be thinking about what are the best, if you have to choose them, the safer disinfectants for use around young children. Okay, so contact time or dwell time is a term that most of you have probably heard of before, but it's the amount of time that the substance needs to remain wet on the surface. So this can range anywhere from about half a minute to about 10 minutes, and they all vary. But you want to choose something that you can realistically do. So for instance, with young children, if you have kids within your home or nearby, you would want to opt for a product that has the shorter dwell time. So you would spray it, you would keep it wet for what it says on the label instructions, and then you could wipe it. If you are not abiding by the dwell time or the contact time, then it won't be effective as it says on its label instructions. So it's very important to just really make sure that you've spent the time reading through the label once you've determined which product you're going to use. As was shared before, disinfectants should not ever be used by children. So just making sure that the adult providers within the home-based facility are the ones doing that work and that children really are kept as separate as possible when sanitizing and disinfecting is happening. You want to have your poison control number immediately accessible in case there is any unfortunate exposure to young children. And again, it's very important to think about kind of storage of these materials. So you want them out of sight, locked in a cabinet in their original jars or containers. So again, you would always have that opportunity to go back and read the label according to the product that you're using. At the very bottom here, we have a second resource that we created at Children's Environmental Health Network, which is kind of part 2 for cleaning, sanitizing, and disinfecting. And again, you're going to find that it's just like a one-page front and back. And from there, if you're looking at it online, you can be clicking into these various hyperlinks of resources that we have found to be most useful. Okay, so when your EPA approved alternatives to bleach, so disinfectants that are not bleach are not available, then you can still use diluted bleach. And we get this question often within the confines of what we refer to as household chemicals. So if you're choosing to use bleach, which a lot of providers do because it is affordable, people are familiar with it and it's easily accessible, you really have to pay attention to the type that you're choosing. So first of all, bleach shouldn't be used when children or even adolescents are present. So making sure that you are separating the children as much as possible when you're doing disinfectant cleaning with bleach. We know that bleach from research shows that bleach contains respiratory irritants. So basically it can trigger or asthma or allergies. And so just exposure to bleach can be problematic for children, even if they're not drinking it, just breathing it in. So what we want you to do is think about reading the label to make sure that you are very much aware of the concentration of sodium hypochlorite. So there are various concentrations of bleach on the market, and the concentration of bleach is important because then that will let you know how you're diluting the bleach to meet the standards that are designated within your child care licensing regulations per your state. So you want to make sure you're using the small amount of bleach that is required per the amount of water. And if your state says, well, we want to point to the National Health and Safety Guidelines, which is often the case, then you're going to go back to Appendix J or K within Caring for Our Children of the National Resource Center. So here are some ventilation resources that we have found to be very helpful. The first one is from the California Child Care Health Program. The link is right there. And then we also have the California Air Resources Board air cleaning devices for homes specifically. So again, this will give you more information specific to ventilation to accompany the work that you're doing around cleaning, sanitizing, and disinfection. And then we also have the majority of our resources now also available in Spanish in the link provided below.
Thank you, Hester. Next, I'll turn it back over to Bob to walk us through healthy facilities.
One of the things I should mention early on, and this is by definition, and this is for all you people out there that are saying you're hearing the terms sanitizer and disinfectant. A sanitizer requires at least 30 seconds contact time. By definition, a disinfectant requires 10 minutes contact time by definition. So when they are evaluated for EPA, and these are the ones that are toxic, they are evaluated per that contact time, and then it's so listed. So sanitizers are about 10 to 30 seconds. 30 seconds is what we're looking at. But disinfectants is a 10-minute contact time, and it has to stay wet. So I'm just letting that out there. Okay, clean facilities, and this would include, you spoke about the child care facilities. Again, all occupants of any long care facilities will have similar bacteria within 48 hours. So we can characterize all institutions. This is child care, adult care, office buildings, factories, amusement parks, by the distinct population that are in there. I work a lot with corrections. So my population is largely male, female, between 18 and 30 years old. Child care facilities are, again, based on age, nursing homes, and so on. Now, each facility's population has unique characteristics and health status. That's age, gender, activity, etc. So the cleaning should be targeted to the population and use of that facility. As a general rule, maintaining aesthetic cleanliness will also remove most biological soiling. But we have different populations, and it does require a little finesse to clean the soil that's inherent within that institution or facility. And I'm saying again, disinfection is not necessary. Cleaning is. And the cleaner we get it, we can get down to levels of disinfection. Disinfection is nothing more than putting a belt on pants, making sure they don't fall down. So bacteria, fungi, viruses are part of normal soiling. Removing the soil, including vacuuming, will reduce the total bioburden. Here's the fundamentals of facility sanitation. This even goes with homes if you're taking in children for daycare. Establish policies, procedures, and protocols for the facility. And I say this again because I'm working forensics, and if something should happen and you get sued, that policy or procedure and protocol will keep you out of that lawsuit or minimize that lawsuit. And this should include housekeeping and laundry, maintenance, pest control, and basic safety practices, and dealing with emergencies. And emergencies would be something like someone throwing up, or a flood, or something that on the outside, an air pollution event, or anything like this. That should be in the policy of a facility. Assign responsibilities, including administration. So whoever owns the facility, be it a home or a freestanding or whatever it is, the administrator should be assigned a responsibility and is in charge. The policies and procedures should be audited periodically for, quality assessment, quality control, and quality improvement. Once you've written it, there's always room for improvement. And then reassess cleaning frequency, the equipment you use, chemicals annually. Remember, a dirty mop does not clean. A dirty mop simply makes things dirty. And chemicals, we're seeing new chemicals on the market that are safer and safer and safer. I've gotten away from, in the places that I'm working with, we've gotten away from most everything that is toxic and using lesser toxic products. But by the way, just so you know, it was mentioned the odorants that are in sanitizers and disinfectants. They're mostly lemony and almondy, and both are pretty nasty. So the only ones that I know that are not with odorants are those used, believe it or not, for veterinary use, and that's on the label, or food. So, and they will be cross-referenced for you. So you look for those titles and you'll see underneath child care as well. So use principles of integrated cleaning and measurement in your selection. In other words, go always for the least toxic and the most efficacious in terms of cleaning. Write a contingency policy and procedures for coping with emergencies and unusual circumstances that extend beyond the capability of the facility. In other words, if you have anybody in that facility, there really is an implied warranty that they're going to maintain safe. So you need to maintain emergency contacts and agreement with outside contractors and vendors. So if there is, say, a flood or something, now you have a vendor that can come in and clean it up and decontaminate it accordingly so that it's safe again for the occupants. Establish housekeeping protocols that minimize the use of toxins. I'll keep repeating myself on this. I've done this forever. And irritants, and that would include the use of aerosols and odorants. If there's a malodor, find the source of the malodor. And it's generally something that's septic around the toilet or a sink or a garbage pail that just hasn't been cleaned out for a while. Reassess cleaning frequency, equipment, and chemicals annually, and there we go. As a rule, all common touch surfaces should be cleaned once per shift. In the event of a communicable disease outbreak, consider increasing the frequency. And avoid the use of soft, porous, and irregular surfaces. Anytime children are involved, it's nice to have soft fluffies. We mentioned the teddy bears, and this was mentioned. They need to go into a washing machine periodically. If they fall apart, so be it. Get new ones, but they do need laundering. And you wouldn't believe how many dust mites are part of teddy bears and so on, and pillows. Inspect restrooms hourly, clean and service as necessary, and they maintain adequate cleaning and personal hygiene supplies. Don't use fragrance to cover up malodors. Find and correct the cause. Urine, dry trap, coil soiling, all of these things are the cause of malodors. If you find them, use it. And the other thing I may mention, don't be ashamed to ask questions. Cleaning is not an inherited skill. It's an art form and a science. And cleaning companies know how. And there's a lot of information online on how to clean different surfaces and frequency. Use that. This is always good in a cleaning facility. Conduct monthly grand rounds, including members from administration, maintenance, housekeeping, everybody who's working there or looking after children. And look for maintenance issues, housekeeping, safety, and security issues. Assess your ventilation, lighting. Again, if the lighting's too low, you can't see. Look at your traffic patterns and maintenance problems, including hot water, and check your utility closets. If there's no utility closet, there's always this sink that is kind of dirty. That should be the cleanest part of your housekeeping milieu. Maintain safety data sheets on all chemicals used in the facility. Unfortunately, chemicals that you buy in a grocery store do not come with the SDSs. Rely on good science to develop purchasing specifications and match the chemicals to the facility population. Think sustainability. That's coming in the several states, and things that are sustainable for the most part are also lesser toxic and less onersome on the environment. Select floor maintenance chemicals that may meet ADA requirements for slip resistance. It's interesting, there are a lot of things for cleaning floors that simply increase or decrease the slip coefficient to make them as slick as the inside of a bathtub. Select carpet care equipment and chemicals that do not leave a residue or create a damp condition. If they leave a residue, you'll notice it. A lot of people respond with an allergy to or some irritation to the chemicals left. Most of these are high alkalinity detergents. Ventilation. I believe in maintaining ventilation systems to minimize Legionella. Then you're safe. That includes the air conditioning and heating systems. And there is an NCHH standard 188 that came out in 2015 that gives parameters on cleaning and maintaining these systems. Maintain comfort level, temperatures, humidity, and carbon dioxide. The humidity, if it's kept under 50% relative humidity, we avoid the buildup or the growth of mold. Introduce fresh air as much as possible to achieve at least 6 air changes per hour per occupant. This is facility. And if you have air handling systems, your contractor should be able to tell you how many air changes you're getting. 6 per hour per occupant is the norm, and that'll keep people relatively safe. Clean and rebalance all ventilation systems every 5 years, and then assess facilities for dampness and possible mold growth, and adjust the ventilation accordingly to control these. And then use ventilation to dilute and minimize malodors if necessary, but find the source. And that's it.
Yeah, thanks so much, Bob, and thanks to all of our panelists. I know we're a bit over time here, but hopefully we can sneak in 1 or 2 questions. And if you still have questions, go ahead and enter them into the question box and we can answer them via email. We did have a question come in about if people are going in for a required inspection or visit, can any of these cleaning and disinfection procedures be used to share with clients during those healthy home visits? I don't know if any of our panelists want to take a shot at that. If you're required due to case management or at home environmental inspection to go into a home, how can you share these cleaning and disinfection procedures with those clients? Therese or Bob, do you want to weigh in on how, on what key messages you should be sharing if you're required to enter a home?
Well, up until recently, I was a health director, municipal health director, and we did indeed do this. What we would normally do is take a look at the housekeeping within the facility. This would be, where you have a home that includes other children, a daycare center or something like this. And we simply go through it and look at the equipment, the facilities that are used, and the chemicals that are used, and start recommending those that are the best cleaners and those that are the least toxic. And there are vendors in an area. I always maintained a list of maybe 5 different vendors that they can call upon. There's no bias there, so they can call upon them. And I've told the vendors ahead of time, I said, don't sell them magic juice just because you want to make money. These people have a serious concern. So remember, they're out to sell chemical, and indeed, we're seeing that a lot, but we also want to maintain a healthy and safe facility.
Mm-hmm. Great. Next, we have a question here. How does this guidance adjust given the recent statements that COVID-19 is spread through air and not on surfaces? Therese, I'm wondering if you could take a stab at this. I know you kind of talked about the new guidance that was updated by CDC, but if you wanted to elaborate on that.
Yeah, absolutely. So that is, I think, the reason that CDC has changed their direction for daily disinfecting if you don't have a case or aren't in high transmission areas. And then they also, as I mentioned, they definitely tie keeping oneself and others safe from fomite transmission. The best thing we can do is wash our hands. So I think, yeah, that is directly in line with kind of what we're seeing, that, we're understanding more and more about the aerosolization versus fomite spread, which was much more of a concern early on in the pandemic before we understood that.
Mm-hmm.
Let me have a go at this a little bit. I would advise everybody to stay away from the antibacterial soaps for the simple reason they contain PCMX and a few of the other nastier chemicals. All you have to do is remove the transient bacteria and the soiling from your hands. The mildest soaps are the Castile soaps. They're made from vegetable fats, and we're using them in hospitals more often than not because they have to wash their hands frequently. If you take off the transient bacteria, washing your hands frequently, you're not going to be carrying around a whole bunch of everything. The fomital spread is a real thing. We all touch our face, and you'll notice if you drive in a car, everybody's picking their nose in the car. That mucus winds up on steering wheels, it winds up in homes. You cannot throw a surface disinfectant on there and hope that you're going to destroy the organism. So if anybody has a nasal discharge or anything like this, the cleaning of that discharge and then following with maybe a sanitizing agent, that is the best there is. Remember, the aerosol is the most frequent way of transmitting, but there's also a body of knowledge that says the hands touching that discharge on a horizontal surface, or even on a vertical surface for that matter, like a doorknob, and then touching your eye or your nose or your mouth will introduce the organism. Mm-hmm. Wash your hands, wash your hands, wash your hands.
Yes, yes. All right, I'm going to sneak in one last question here. Again, still feel free to enter your questions into the question box and we will get those answered to you via email. But this one last here, is it good to use Lysol disinfecting spray? Do either of you?
No.
I figured you would say that.
No, the reason for it is Lysol disinfecting spray is a quaternary ammonium chloride compound. Quats, we don't know how they work, but we do know that they're toxic enough to be evaluated under FIFRA. Using those around children, I wouldn't. The aerosol itself, just the aerosol with the propellant, that is enough to trigger asthmas and respiratory problems. Do not use aerosols. Throw them out. There's no such thing as an air sanitizer. It doesn't exist, no matter what they say. And what I find interesting is that a lot of these companies will advertise something that they cannot substantiate, and people believe it. So no, please don't use any aerosols around children.
Great. Well, thank you so much for hanging on for a couple extra minutes. Thank you again to our panelists. This has been a really robust presentation and conversation. And again, we'll continue these to answer your questions offline. So have a good rest of your afternoon. And thanks, everybody.